Well, not that I'm keeping count. Yesterday was the 3-month anniversary of my hip replacement, so we thought it would be a good time to check in with my surgeon, Dr. Peter Sharkey of the Rothman Institute at Riddle Hospital. Dr. Sharkey, good to see you.
Good to see you.
And thank you so much again, you and your team, indeed. Talk to me about, and tell everybody, first of all, what you saw with my hip, and it's actually the femoral head, right, that goes into the socket. What did you see?
Yeah, the hip is a ball and socket joint, and if you recall, we had talked a few years ago about your hip, and I don't know whether it's your pain tolerance or whatever, but you waited a lot longer than most patients.
I think you told my family I should have gotten it like 5 or 6 years ago.
Well, it could have been that long.
Really? Wow, wow. So it wasn't in good shape at all.
Well, it's probably from all those years of sports.
That's right.
Used to taking pain.
That's right. That's right. That's right. I talk to people, Doc, age 30 to 92. When is the right time for someone to have surgery? I guess it has to do a lot with pain tolerance and quality of life.
Well, it's the second part. What you just said, quality of life. That's when you get it done. That is the most, it's the most basic question we ask patients. We say, what has this done to your quality of life? And truly, if you say, this problem has changed my quality of life, altered it dramatically, then if you were my own brother, I would do the surgery, because there's a 98% chance we can restore your quality of life. That's what the surgery is all about, giving you back your quality of life.
Well, brother, you gave it back to me. I just want to shake your hand for that right now.
Well, in your case, it was just fixing your golf game.
That's true. That's right. And I'm putting better, too. When it comes to recovery, I'm in the 3-month stage right now. How long do you think it would take the average person to recover to you are feeling 100%, 110%? I think I'm about 85 or 90 right now.
Yeah,
after 3 months.
Believe it or not, you're probably overestimating where you're at, because the way we usually tell patients, we say, look, you know, by 6 weeks, you should feel better than before the surgery.
Okay, I did.
By 6 months, you're about 50% recovered, and at 2 years, you're as good as you're ever going to get.
Very good, very good. And what type of approach did you take with me as far as getting to the hip? I hear there's anterior and posterior or posterior?
Yes, well, there's anterior, there's posterior, there's direct lateral. There's an approach where we cut the bone to get in there, and different surgeons have reported excellent outcomes with all the different approaches. We happen to use an anterior approach in your particular case just because I've had a fair amount of experience with it.
Sure.
I like the approach. I think patients recover well from it, but surgeons really should use whatever they're comfortable doing.
Just about out of time, and you're looking at my rehab right now. I went over to ATI therapy, but folks can go to any therapy. But it's crucial to do your therapy. You do what you do, but people have to do their therapy, right?
Absolutely. It's so critical. And I saw one of your shows earlier where you showed all the exercises you did. That was the key. You know, it's not an operation you get better from in 2 days. You have to put the time in. You have to exercise. And I can put the parts in right, but you had to do what you did, and you did it right. Thank
you, sir. Thank you and your team, Dr. McCurdy, the cardiovascular, everybody at therapy, at Riddle, and at ATI. Thank you, sir.
They loved you, too.
It was a good time. Thank you. But I'll save the right one. We won't talk about that one later. We'll do that later. For more on hip replacement and the Rothman Institute at Riddle, please go to CBSPhilly.com. Click on Talk Philly. Get your life back if you need it. I'm telling you, they do wonders nowadays. Katie's forecast and an ambush makeover on the other side. We'll be back.